Hello everyone, welcome to Kavya based nursing. I'm Kavya. In this channel, you will learn nursing subjects easy and in simple way. If you are a BSc nursing, GNM or ANM students, do not forget to subscribe my channel. Thank you. Today topic is urinary tract infection in pregnancy women. Urinary tract infections occurs in about 5% of postpartum women. They occurs in 15% of women who have undergone postpartum catheterization. Definition: the urinary tract infection is an infection in any part of the urinary system, kidneys and uterus, bladder, urethra, and most infections involve the lower urinary tract, bladder, and the urethra. Causes: ascending bacterial infections account for most UTIs. Another cause of UTIs is retention and residual urine due to over distensions and incomplete emptying of the bladder. The temporary urine retentions may be due to decreased perception of the urge to avoid and resulting from perineal trauma and the effect of analgesia and anesthesia. Urinary status and residual urine provide a medium for bacterial growth, predisposing the client to cystitis and pyelonephritis. Causative organisms in cystitis and pyelonephritis include E. coli, most common, Proteus, Pseudomonas, and Streptococcus aureus and Streptococcus faecalis. Consequences of not recognized early symptoms of UTI include the extension of the infections upward with subsequent permanent loss of kidney functions. Clinical manifestations. Clinical manifestations depend on the types of infections, and clinical manifestations include frequency, urgency, and dysuria, hematuria, and nocturia, and temperature elevations and suprapubic pain. And pyelonephritis manifestations include high fever, chills, and flag pain, nausea, and vomiting. Diagnostic evaluations: midstream urine for bacteriological investigations. Management: treat with the appropriate antibiotics such as ampicillin, nitrofurations, or nalidic acid. Orally administer potassium citrate mixture. Nursing management. Assessment: assess the mother by taking history from women related to retention of urine, pain on maturations, and malaise. Check the vital signs to assess the fever, whether having or not. Assess the perineal area and vulvar area to assess hygienic conditions. Assess the knowledge of women related to urinary tract infections and its complications. Nursing diagnosis: alternate urinary elimination related to urinary tract infections, hypothermia related to increased metabolic rate due to illness or trauma, knowledge deficiency. Nursing interventions: review the lab test and determine the patient previous pattern of eliminations, and palpate the bladder to assess retentions, and determine the patient's usual daily intake to assess the condition of skin and mucous membranes, and encourage fluid intake to maintain renal function and prevent infection. Monitor medication regimen to identify patient response in treatment. Keep the perineal vulvar area clean and try to reduce risk of infections and monitor medication response to identify patient response in treatment. Thanks for watching. If this class was helpful, please like, share and subscribe to Kavya BSc Nursing. In the next class, we will discuss another topic. Thank you.